Here's the key. You buy what you want to buy. If you don't want to use your tax credit to go buy health insurance, you don't have to. If you don't want to buy this plan, you want to buy that plan, go for it. It's your choice. It's freedom. It's called free market health care.
House Speaker Paul Ryan, one of many Republicans who want the free market to handle health care. The Grand Old Party believes that the way to solve a lot of the nation's problems is just that. But New York City-based ER doctor Farzon Nahvi says it just doesn't work when it comes to medicine. He recently wrote an op-ed in the New York Times, and here's part of it. Quote, Republicans need to be honest with themselves and the public. If they want medicine to be truly free market, then they have to be willing to let the next man or woman they find lying unconscious in the street remain there and die. In a truly free market, we cannot treat someone and charge someone without their consent and against their will. Well, I recently sat down with Dr. Nahvi, and he explained what he meant by that. So we gave a little bit of the op-ed piece that you wrote that has sparked a lot of conversation. But give the general idea, because certainly as they debate this in Washington, the premise of a free market system, it sounds good on paper that people can buy what they want, not buy what they want, but at the end of the day, they hold in their hands their health care. You say, well, it sounds good in practice, though, and also in theory, it's not what's best for medicine, let alone best for the patient.
Well, I would even go further than that. I wouldn't just say it's not just what's not best, it just doesn't work. And like you said, it is a good idea, right? The free market made us the richest country in the world. Free market introduces efficiency to kind of a lot of the sectors of the economy. But in healthcare, it just doesn't work. And the way I would frame that is that if we understand what the free market is, which is kind of people making self-interested decisions, which ultimately leads to more efficiencies and the greatest common good, it just won't apply in healthcare.
And in the piece, you lay out 3 specific examples that I think people could get their arms around. You had a middle-aged jogger, dehydrated, passed out, and Good Samaritan, see it, they call it in. You had another person who at his desk, all of a sudden from a bleeding ulcer, passed out here in a pool of blood, and his coworkers called an ambulance to rush into medical service. And then finally you had another incident where a guy was found lying on a street corner or on a curb at 3 in the morning. I think people assumed he was drunk. It turned out he was beaten by muggers and again rushed for emergency service.
Right.
What all 3 have in common is nobody could check what health care coverage they had at the time. There was an emergency need.
Right.
This is the Hippocratic Oath that you guys all swear to take. But they all had in your story something in common. They were fearful of the sticker shock, which is an indictment as to where we are right now.
Right. And in a free market, pretty much, you wouldn't be able to do that because people have to participate if you want the free market to work. And these people couldn't participate. They couldn't make the best decision for themselves. They couldn't make any decision because they were unconscious. So we had to step in and take care of them. And that happens more often than not. And then when you have that kind of situation, I think the whole notion of a free market kind of falls apart when half the party can't participate in the market.
Now, you've seen, and certainly colleagues have seen the before and after, and nobody says the ACE is perfect here. Even the authors of it said it was meant to be a starting point, not a finish line. But I've spoken to people I know who say, especially in the poorer hospitals, in the inner cities, or in rural hospitals where there's no margin for these hospitals, the emergency rooms that were the places, and still many times are a first and last resort for the uninsured, that problem becomes on steroids, and then it gets to the point where you got to shutter doors. Describe the math a little bit here. How worried are people that if somehow, some way, there was agreement in Washington to really cut back on Medicaid, to really cut back on the mandates that are part of this policy, what would happen to the hospitals? Hospitals like yours, emergency rooms, who treat a lot of times the indigent or the uninsured.
Well, we treat everyone that comes in the door. That's our motto. That's what we need to do. If you come in, you're undocumented, you have health insurance, you don't have health insurance, you have a high deductible insurance, we're going to treat you. I'm going to leave the finance to the finance people, but it's basic math. If you come in and you can't pay, but we still need to treat you, eventually that's going to add up.
I guess the question is, if Paul Ryan or some of the more vocal opponents to the current system that want to take it a different direction, which is to say, you want health insurance, you should get it. You don't want to get it, don't have it. If you had a day with them where they could shadow you in the ER, where do you think you might change their mind, and do you think you could?
I would just point them to the patients that we have that aren't able to make decisions. So a lot of people don't know this. If you have a simple infection and you're old enough, you could not be thinking straight, not thinking clearly. If you are bleeding, or have a heart problem, or have a brain problem, you could be unconscious at any point. And this could happen to anyone. And I would point them to these people and say, if you're telling them they have to make decisions that's right for them and say, hey, cost benefit, is this worth it for me? How are you going to have that conversation with someone that can't make decisions? How are you going to have a conversation with someone that isn't thinking straight? And I don't think he'd be able to answer that.
It's interesting, Doctor, because I get the sense from you, it's not so much a philosophical conversation, it's a practical conversation. That there is just realities about who walks in the doors, what you have to do, or you change your entire model and you turn people away and say, sorry, go find somewhere else to die, in effect, here. If you don't have health insurance, you're on your own.
Absolutely right. Yeah, I'm not anti-free market by any stretch of the imagination. I think it's a great tool for the economy. It just cannot be applied here. It just doesn't work.
Well, it was a really fascinating op-ed piece here. Don't leave healthcare to a free market. We've linked it to our website as well. Doctor, I appreciate the time. Thank you so much.
Thank you very much for having me.
Absolutely. And up next, we're going to take a look at the latest when it came to that tragic military plane crash that took the lives of 16 people, including 9 Marines stationed at Stewart Air Base in Newburgh.